It's great to be with you again. Today, as the governor said, I want to walk you through what we look forward to beginning tomorrow in terms of additional sectors that are coming back to business, as well as talk a bit about the regional variance process that we've been hard at work describing here and are ready to put out in the next day. So this is a reminder that California's decision to modify the stay-at-home order is based on science, data, and public health. And we have for weeks, months now, been looking at that data, been updating you on a daily basis, as well as explaining how we believe we are in what we call our range or zone of stability with our hospital data and our death data across the state. And that gives us confidence to move into this stage 2 of modifying our stay-at-home order. What does it mean to move into stage 2? It does not mean a return to normal. We know that COVID-19 is still spreading. Daily, the governor updates the number of new cases. Even despite increased testing, we still see a number of new cases. Despite an increased ability to do contact tracing, we still know that the virus is alive in California and that your good efforts have helped us suppress it quite a bit, but it is still there spreading. And we know that we're going to gradually reopen California only as we can reduce the risk to all Californians from contracting COVID-19. So what starts tomorrow, Friday, May 8th? We've been talking about that date now for over a week. We've talked about how retailers are going to be doing more curbside pickup, potentially delivery, and all done in that physically distanced way with those modifications. We're encouraging those retailers to install hands-free devices that maybe it's not direct payment at a cashier like we're used to, but a click and swipe type of methodology. We'll see a lot more hand sanitizer outside the door. You'll see staff from the retailers coming out to your car potentially to deliver goods with gloves and a mask on. What does it mean for manufacturers? It means that that normal manufacturing plant may have people further apart than they were before COVID-19. It may mean that their break rooms have been closed down and exchanged for open air break rooms with physically distanced seating. Warehouses might look very much like those manufacturing businesses as well, and maybe their delivery trucks are full with sanitation materials, and the people doing the deliveries will have different personal protective equipment than they did before COVID-19 became a reality. We know that this is going to be a gradual move into stage 2. We are going to be able to add more businesses and sectors as the data allows us, as the guidance is created, and as we can assure that we are able to reduce risk. And as we watch, as people begin to move in California more and more, that we're still able to suppress through our testing, our contact tracing capabilities across the state, so we don't lose the important gains all Californians have helped contribute to over the last many weeks. This gradual move into stage 2 means that later, soon and later, things like offices that haven't been able to telework will open. Seated dining at restaurants. I know many of you look forward to that day when you can return to your favorite restaurant, get your favorite meal, and we're also looking forward to that, but only when we can put out guidelines with specifications on how those restaurants are set up, and we know and are confident that the data in your region across the state can be supported so we don't have an increased spread of COVID-19. Shopping malls, the ability to not just go to pick up something that you ordered online from that favorite store, but to be able to go to that mall in a low-risk way. Outdoor museums, as the governor mentioned, something that I think we're all looking forward to having open, but under the guidelines of how to do that in a physically distanced way with the safest conditions that we can create during this COVID-19 period. We also are going to be putting out industry-wide guidance, and these guidances will allow us as the public to know how our retailers, how our industries are setting themselves up in a COVID-19 period as they return back to work. These guidances will allow us to have detailed risk assessments done by these employers, the training of employees on how to limit the spread of COVID-19, how to screen for symptoms, possibly temperature checks, symptom checks on a daily basis, and of course, as we've talked about, staying home when someone's sick. We'll ask industries to implement site-specific protection plans, cleaning and disinfecting protocols, and of course, the physical distancing guidelines that we've been talking about for many, many weeks. I want to talk a little bit about what the governor mentioned earlier in the week, that Dr. Angel walked us through early in the week as well, and that just a few minutes ago, the governor said a little bit more specifically about, which is this concept of regional variants. As we have been reporting out statewide data, we know that COVID-19 has impacted different communities and different counties across the state in very different ways. There have been some counties with few cases and no deaths for many, many days, and that has contributed to the excellent data that we've seen across the state. And we know that some counties can move safely further into stage 2, as they can attest to a number of the things that I will walk you through in a moment that they're able to achieve. And these are all based on California Department of Public Health criteria. So in order to achieve or attest to the regional variance criteria, we need the public health officer, and let me just take a moment and thank the public health officers across the state for the tremendous work, not just locally, but statewide, coming together, having very challenging conversations, thinking through some very hard decisions, and keeping Californians safe using data and health throughout the many weeks. And the work continues as we consider this regional variance criteria. Things like counties being able to attest that they've had no more than one case per 10,000 people in the last 14 days, no COVID-related deaths in the last 14 days, that they're able to protect our essential workers. Those are our grocery store workers, our transit workers, with protective gear, and that they're able to support those same workers when they're sick or exposed to COVID-19. That we have adequate testing capacity in those counties, a minimum of 1.5 tests per 1,000 residents. That we're able to do that contact tracing with those disease detectives that the governor's been talking to us about, with at least 15 contact tracers per 100,000 residents, and that furthermore, we're able to support with temporary housing a good number of those residents in our counties that are experiencing homelessness and may become COVID-19 positive. We also, as the governor mentioned, we depend on our partnership with our hospital systems in our counties. We want to make sure that each county is able to work with their hospital systems and have at least 35% capacity for surge. We talked about early on that we look to add 50,000 beds across the state for potential COVID-19 surge. This, when you break it down at the county level, at the hospitals, it is a minimum of 35% in each of those counties' hospital systems to be able to potentially handle a surge in COVID-19 cases. Furthermore, that these hospitals have a robust plan to protect their hospital workforce with the PPE and other policies and procedures that keep them safe. We've talked about vulnerable populations since the beginning. We know that many of our skilled nursing facilities and other congregate care facilities must have PPE, and in order to attest for the regional variants, a public health officer must be able to say that their skilled nursing facilities have more than 14 days supply of PPE, as well as an ability to order additional PPE from suppliers when that 14 days is running low. And also, as the governor mentioned, we need to make sure that each county has the ability to understand their data and pull back from some of these modifications, slow down in some cases, reinstitute those modifications again in other cases based on their data and their own county-wide situation. We look forward, the Department of Public Health, California Department of Public Health, will post these guidelines to a test for regional variants on the CDPH website. We are also building a team at the state to provide technical assistance to the counties to review their attestations, to ensure that all of these different criteria are met, and those will all be publicly posted for you and your communities and counties to understand what your county is doing to ensure that they make your communities as safe as possible as we look to reopen certain parts of our communities and our businesses in the days and weeks to come. And with that, I'll turn it back to the governor. Thank you.